Welcome back. The Centers for Disease Control says that as of late last month, there were nearly 100 recorded cases of measles here in the United States. That is compared to last year when there were 58 reported cases in all of 2023. Symptoms of measles include fever, cough, small grayish-white spots in the mouth, and loss of appetite. And here to tell us more about measles and the recent outbreak is Dr. Paul Cieslak, Medical Director for Communicable Diseases and Immunizations at the Public Health Division of the Oregon Health Authority. Doctor, good to see you again. So what more can you tell us about this recent outbreak?
Well, measles was declared eradicated in the United States back in the year 2000, which means that we don't see any transmission here unless it's imported from another country where their measles is circulating more widely. So certainly these cases of measles started with importations from abroad. There's still a lot of measles going on in Europe. And most of us are at very low risk because we're either vaccinated or we had measles as a kid. But the younger generations, if they're unvaccinated, they're at risk. And if you put a case of measles into a highly susceptible population, it really spreads like wildfire. Basically, everybody who's susceptible is going to get it.
Yeah. And what about herd immunity, though, in all of this?
Right. Well, with measles, because it's so highly contagious, you need a very high proportion of the population to be immune before you get so-called herd immunity. You probably need upwards of 93% of the population to be immune. We have, certainly a lot of schools and entire states, in fact, where vaccination rates measured at kindergarten are hovering around 90%, which is well below the herd immunity threshold. And, we have some schools where it's very, very low indeed, where almost none of the children are vaccinated. And that's, dry tinder waiting for a match as far as measles is concerned. Put a case of measles in that kind of environment, and basically everybody's going to contract it before public health can even move in and do anything.
Yeah. Where are we seeing most of these cases? Do you know?
Chicago actually has most of the 97 cases reported in the United States as of March 28th.
Wow. And something to look out for sure. What should parents be on the lookout for?
Well, first of all, I would say make sure that your child is vaccinated. 2 doses are recommended. The first one is typically given at 12 to 15 months of age, and the second dose in the preschool ages, 4 to 6 years of age. And if you've had those 2 doses, you're at very, very low risk. But the signs of measles are typically a fever, it can be high, 103 degrees, 102, 103, 104 degrees, followed by a rash, blotchy red rash that starts on the face and then spreads southward, if you will, to the rest of the body. The other symptoms that go along with it are what we call the 3 C's: cough, coryza, conjunctivitis. Coryza is basically stuffiness, a head cold, and conjunctivitis is inflammation of the eyes. So red eyes and cough, along with the fever and the rash, should suggest measles to you.
Doctor, we're almost out of time, but quickly, are there any other diseases that you're concerned about, maybe on the radar for you, and what should we be watching out for as parents?
Well, we're still in the middle of respiratory viral season. And so, the things that are most likely to make you sick right now are still COVID-19, influenza, and RSV, respiratory syncytial virus. They all seem to be going down at this point nationally, which is, nice to see. But they're still out there and they're still putting people in hospital.
All right. Well, Dr. Cieslak, thank you so much for coming on. We appreciate your insights. God bless.
God bless. Bye-bye.